Good afternoon. Joining me from the Maryland Department of Health are Secretary Dennis Schrader and Deputy Secretary Dr. Jinlene Chan, as well as the Executive Director of the Maryland Primary Care Program, Dr. Howard Haft. Thanks to the continued resolve and vigilance of Marylanders, our state was recently ranked as the safest state in the nation during the COVID-19 pandemic. And after emerging from the peak Omicron wave faster than any state in America, state hospitalizations, which is the most important metric that we monitor, are plateauing at a rate 86% lower, and ICU levels are 90% lower. In my State of the State address back in February, my message to Marylanders was that we must all learn to live with the virus, not to live in fear of it. And I want to thank the people of Maryland for doing exactly that. Our state public health response has now fully transitioned from an emergency into an ongoing operation of state government. And as the next phase of our nation-leading response and recovery, today I'm announcing our COVID-Ready Maryland Plan to maximize all of the available tools and treatments for preventing severe illness and keeping people from being hospitalized, and to maintain an ongoing state of readiness over the long term so that we are well prepared to respond to any emerging future variants or any potential waves or surges. The first pillar of the COVID-Ready Maryland Plan will expand on the federal Test to Treat program to make it easier for patients to get tested and to start treatment in the same visit. Too often, if people tested positive, they'd have to wait to get a doctor's appointment and then get a prescription and then go to the pharmacy to try to get that prescription filled. And that cumbersome process sometimes led people to decide just to go to the hospital instead, which placed further strain on the healthcare system. So the Test to Treat plan changes all of that and makes it all a one-stop process. We recently launched Test to Treat at our State Center site in Baltimore City, where visitors can receive a rapid COVID-19 test, and if they test positive and treatments are appropriate, they can receive a clinical evaluation and a prescription for oral antiviral pills and have it filled right there on site. And all of that is at no cost. If you don't have time to go see a doctor or visit one of these sites, we have also established a free self-referral service in partnership with the University of Maryland Medical System, where you can simply set up a telehealth consultation and receive a prescription if warranted without leaving your home. Just over the last few months, we have nearly doubled the amount of Test to Treat locations in the state. We currently have 88 locations, and through the COVID-Ready plan, which we're announcing today, we will be expanding our Test to Treat infrastructure so that we're able to activate dozens more urgent care and ambulatory care providers to provide these services. As part of our continued focus on protecting our most vulnerable, we have made sure that every single skilled nursing home facility in the state is now aligned with a pharmacy partner for testing, vaccines, and therapeutics. And as a result of our aggressive efforts earlier this year to secure more testing supplies, we now have on hand approximately 2.3 million rapid at-home tests. Especially important as we head into fall, we continue to make these resources available to every single school system all across the state. The second pillar of our COVID-Ready plan is increasing and maximizing the utilization of therapeutics, which are a relatively new and effective tool in our arsenal in fighting the virus, and are rapidly becoming more prevalent and more important. In a one-month span this spring, we increased overall therapeutic utilization by 248% in Maryland, which is a key reason why we're seeing far fewer people getting severely ill, being hospitalized, or dying from COVID. There are now several different types of these treatments available, including oral antiviral pills, which interfere with the virus's ability to replicate. And these treatments are not cures, but they have a very high success rate when it comes to lessening the severity of symptoms and in keeping high-risk patients out of the hospital. We want to make it clear that any healthcare provider, including primary care and urgent care facilities, can make referrals for treatment and therapeutics, and they're currently available at hundreds of locations across the state. And Dr. Haft will provide a more thorough briefing on that program in just a few moments. The third pillar of our COVID-ready plan is getting more Marylanders vaccinated and boosted as they become eligible. And vaccines remain our most powerful weapon against severe illness and death. And fortunately, Maryland continues to be one of the most vaccinated and most boosted states in America. We have now administered nearly 12 million vaccinations, including more than 2.4 million booster shots, and we have built up one of the strongest provider networks in the nation, with 941 vaccine providers currently available on covidvax.maryland.gov. We've been successful in enlisting more than 700 primary care provider partners to be a part of the ongoing vaccination effort. And while it has never been easier to get vaccinated and boosted, we recognize that mixed messaging from the federal government has made it harder to know when it's actually time to get a booster shot. And from our own outreach, many people have told state health officials that they weren't sure if they needed it or didn't even know if they were eligible. So the simplest way to put it, the easiest way to remember, is that everyone 5 and older is eligible for one booster, and everyone 50 and older is eligible for a second booster. All of the data shows that protection from the vaccines does wane over time, and so no one should consider themselves fully protected unless you have gotten a booster shot. And to cut through the confusion, today we are launching a new web portal that will let you know within seconds whether you are up to date on your COVID-19 vaccines. And if you're not up to date, you will be directed to the site where you can immediately schedule an appointment. In the coming weeks, we anticipate that COVID-19 vaccines will also become available for Maryland children 5 years of age and under, and Dr. Chan will be providing an update on that in just a few minutes. The fourth pillar of our COVID-ready plan is outreach and public awareness. Our GoVax call center remains available to Marylanders 7 days a week at 1-855-MD-GoVax, and it has now facilitated nearly 2 million vaccine appointments. We're in the process of conducting a number of text and phone campaigns around eligibility for booster shots, scheduling vaccine appointments, and raising awareness of therapeutics. This week, we are also launching the next round of our public service announcements on television and through social media, featuring testimonials from families who have been affected by COVID. The fifth pillar of our COVID-ready plan is surge preparedness. Through the Maryland Department of Health and our multi-agency task force, as well as our ongoing coordination with the White House and federal officials, the state continues to constantly assess any possible impact of emerging variants, to monitor levels of community transmission and outbreaks, and to maintain critical public health resources, including a robust variant sequencing program, PPE supplies, hospital surge capacity, and contact tracing for high-priority cases and vulnerable populations. And we have also provided record levels of funding to local health departments to bolster their preparedness efforts. We continue to stand ready to adapt and respond just as we have over these last 2.5 years. After this press conference, the First Lady and I are hosting a special thank you reception at Government House to honor and thank many of the countless heroes who have helped our state lead the way in responding to COVID-19 and who will ensure that Maryland continues to lead the nation in health and economic recovery. The most important thing we can all do to support our healthcare heroes as we go about our daily lives and as the number of cases goes up and down is to continue to be smart and to exercise personal responsibility so that together we will continue to be COVID ready and Maryland strong. With that, I'm going to turn it over to Maryland's Health Secretary Dennis Schrader to discuss more about our expanded Test to Treat programs.
Thank you, Governor. Good afternoon, everyone. On June 1st, the Department of Health issued an invitation for bids, or it's also known as IFB, for urgent care centers, ambulatory centers, community providers, or pharmacies in the state that already offer COVID-19 vaccination, testing, and therapeutic treatment to apply for funds to rapidly expand COVID services when needed. We're launching this program to ensure that Marylanders have under one roof throughout their communities easily identifiable locations that can provide access to the main tools needed for meaning vaccines, tests, and therapeutics so they can stay safe, healthy, and COVID ready during the potential COVID surge periods as we move forward. Having COVID service centers on the ready throughout the state and making sure Marylanders know where they should go to access them if they need to will also alleviate undue pressure on emergency rooms and hospitals as a whole. This is one of the lessons learned from our experience through the Omicron surge earlier this year. Through this IFB, we are able to award funds to operate up to 50 COVID service centers in the state. And the IFB also focuses on geographical representation based on the 5 regions established by the Maryland Institute for Emergency Medical Services, also known as MIMS. As the governor said, as part of the COVID ready, the Department of Health will continue to closely monitor the transmission of COVID-19 and the emergence of new variants in the state and region, and we have been doing this every day for 2 years. When it comes to activating the service centers, we'll make a data-driven decision using our invaluable state data, CDC's community-level indicators, and other information, as well as our discretion. I want to encourage all of the interested entities to take a look and apply for the opportunity to establish a COVID-19 service center. All of the details are on EMA. The link is emma.maryland.gov. I also want to remind any interested parties that it closes on June 30th, so please apply now if you're eligible. I'll stop there and turn it over to Deputy Secretary of Health, Dr. Chan, to talk about the pending pediatric COVID-19 vaccine. Dr. Chan?
Thank you, Mr. Secretary, Governor. And good afternoon, everyone. I'd like to talk a little bit about the new weapon that the Governor and the Secretary just referenced that we will soon have here in the state of Maryland that we'll be using in the fight against COVID-19. We are preparing to roll out 2 COVID-19 vaccines for children 6 years of age and younger, down to age 6 months, in anticipation that they'll receive approval from the federal government potentially by the end of next week. There are approximately 358,000 children in this age group in the state. And these COVID-19 vaccines, just like other COVID-19 vaccines that we have for other age groups, will help protect our youngest Marylanders against severe disease, hospitalizations, and death. Recently published information also suggests that even among young children in this age group, under 5, that vaccination can potentially mitigate the risk of development of the post-COVID multi-system inflammatory syndrome in children, or the MIS-C syndrome. And here in Maryland alone, we have had 55 children under the age of 5 reported with that condition to date. And that is roughly a third of the total number of MIS-C cases identified in the state so far. In October of last year, the Pfizer vaccine for children ages 5 to 11 received federal approval. Today, roughly 50% of Maryland children in this age group have received at least one dose of the vaccine, and more than 43% are fully vaccinated, meaning they've completed 2 doses. This ranks Maryland 6th in the nation for vaccination rates among 5 to 11-year-olds. And just last month, the CDC approved the COVID-19 booster doses for this same age group, 5 to 11, and during the past 3 weeks, nearly 10% of our 5 to 11-year-olds have already received a booster shot. So we're off to a pretty good start, and we continue to work on this part. But now, the long-awaited next opportunity to protect Maryland's youngest children against COVID-19 is nearly here. Next week, both the FDA and the CDC's advisory committees will be reviewing both the Pfizer COVID-19 vaccine for children 6 months to 4 years old, through 4 years old, and a Moderna COVID-19 vaccine for children under 6 years old. The Pfizer vaccine will be a 3-dose vaccine series, and the Moderna vaccines will be 2 doses. If approved, on Monday, June 20th, COVID-19 vaccines for infants and toddlers will be available in Maryland. The Department of Health has been working very closely with our federal government and our partners across the state to ensure that Maryland will have this important vaccine available for families right away. In anticipation of this, yesterday, we completed our first order of these vaccines, and we expect to receive approximately 65,400 doses initially, with additional vaccines to come. Again, all of this will be pending, and so we'll be watching next week the review and approval by both the FDA and the CDC of these vaccines before they are authorized for use. Our goal with this age group, as it has been for all age groups, is to distribute these COVID-19 vaccines equitably across the state, offering and using our vast network of pediatricians, family practitioners, federally qualified health centers, and local health departments who will be at the forefront of this vaccination effort. To further help parents make the best and informed choice about vaccinating their children, the Department of Health has dedicated a page on our covidlink.maryland.gov website specifically for parents and guardians. The Information for Parents page has links to clinical studies showing the safety and efficacy of vaccines for children, information on the rigorous testing that was conducted, and which went on before these approvals were sought, and other helpful material. It is important that for every family to be informed about the risk of COVID-19 as well as the risks and benefits of vaccines for their children. If families have any questions, we urge you to discuss the benefits of vaccinating your children against COVID-19 with your child's healthcare provider. We hope that you make the decision to vaccinate and boost all of your family members who are eligible. Mine are, and I am very thankful that my family's vaccinated as we look forward to our summer vacations. If you do not have a healthcare provider, or if your provider is not offering the vaccine, you'll be able to search for locations near you for your children 6 months and older to receive a COVID vaccine on our vaccine locator, again, covidvax.maryland.gov, or by calling our GoVax call center at 855-MD-GO-VAX. And you can also contact your local health department in the jurisdiction where you live. So Maryland continues to be a strong leader in the nation in vaccination rates among all ages. And that is an important reason that our recovery from the pandemic has been so strong. We are COVID ready and optimistic about the future. We have made all of these tools available and accessible to everyone across the state, and so that everyone can be prepared. And we'll continue to work to improve the health of all Maryland families. So thank you, and I'd like to now turn it over to Dr. Howard Huff, who will give you some remarks about therapeutics.
Thank you, Dr. Chan. Thank you, Governor, Secretary. And good afternoon. I have good news regarding the ability to treat COVID-19. We have highly effective, safe, widely available, easily accessible medications to prevent severe illness, hospitalizations, and death for this virus, and Marylanders are using them. Monoclonal antibodies, which were administered by IV injection, have been available since November of 2020, but since December of 2021, the more easily accessible, convenient oral antiviral pills were authorized by the federal government and now are widely available across Maryland. The oral medications are indicated to treat anyone with underlying medical conditions within 5 days of the onset of mild to moderate symptoms. Last week, we had more than 64,000 courses of therapeutic treatments on hand and distributed among more than 800 publicly accessible test-to-treat locations, pharmacies, hospitals, urgent care centers, primary care offices, and other places across the state. The utilization of therapeutics among Marylanders who are testing positive for COVID has increased more than fourfold since the beginning of the year. Last week alone, we treated more than 7,000 patients. We expect that the supply and the demand to keep growing for these safe and effective treatments. As a physician with more than 46 years of experience, I'm excited that we're at a stage in this pandemic where in Maryland, there are no barriers to accessing therapeutics. The oral medications are now available in pills that are named Paxlovid and Molnupiravir. For patients who are not able to take those specific medications for reasons of impaired kidney function or other reasons, there are other treatments available, such as the monoclonal infusions that I mentioned and remdesivir, which is an IV antiviral agent. So speak to your doctor if you have even mild symptoms and test quickly if you feel sick. If you don't have a doctor, as you've heard, you can do a home test, visit any one of the hundreds of testing sites around the state, visit one of our test-to-treat centers, or get a telehealth consultation to determine if you are eligible for one of these therapeutic treatments. As the governor said, to make it as convenient as possible to ensure that we are all COVID ready, the state has established a network of more than 80 test-to-treat sites, and as the Secretary said, we're adding more all the time. The current test-to-treat sites and COVID service centers that will be established offer one-stop shopping for patients who want to walk in with no appointment, take a rapid test, undergo a medical evaluation, and be given a prescription at one convenient location. You can find a test-to-treat site near you by going to covidtest.maryland.gov and using the locator tool. Testing quickly and seeking treatment options right away is particularly important for those who are over 50 and those who are younger with any significant underlying medical conditions. You should take advantage of these treatments to avoid the worst consequences of COVID, including hospitalization and death. We also want to remind our patients who have moderate to severe immune deficiencies to contact their medical providers to see if they're eligible for Evusheld medication. This is a therapy that's provided as an injection that produces protection against COVID infection for many months in the future. COVID may be with us for a long time into the future, but the very good news is that we have vaccines to protect ourselves and our community and medications to treat this disease safely and effectively. Thank you very much. Governor, I'll turn it back to you.
Well, thank you. With that, we'd be happy to take a few questions.
Governor, earlier today, you released a report calling for a criminal investigation in Baltimore City Public Schools and grade changing in reference to the IG's report that came out 2 days ago. What is in that report? Project Baltimore has been reporting for 5 years. Why do you think officials in the city, the state's attorney's office, the attorney general haven't already called for a criminal investigation or launched one?
Well, it's a great question. I mean, this has been kind of an ongoing process that's taken far too long. And yeah, as you know, and you did a great, your station, your Project Baltimore, I think did a great job uncovering some of these facts and bringing them to people's attention. We have been, speaking out about this, trying to get to the bottom of it from the beginning. Baltimore City Schools did their own investigation, which said none of the wrongdoing took place. So that was obviously a fraudulent report that covered up the wrongdoing. I fought to, the legislature killed President Obama's ESSA legislation to try to make schools more accountable and to fix persistently failing schools. It made us, when they failed to do that, the least accountable school system in America. I kept fighting for years, and we pushed for much more accountability. Most of our efforts were not successful. About 90% of it was rejected by the legislature, but we were successful in getting the state IG for the first time ever, who's been conducting this investigation since 2020 and released these results. So I think there's been an ongoing awareness of the problem and different people with the responsibility looking into it, but it took persistence, and it took this IG, which we had to fight hard to get on board, to gather the information, to do the finding of fact, to find, just in the high schools, these 12,800 kids whose grades have been improperly, fixed.
Governor, I wanted to ask you about the violence in Baltimore. And the truth is, most of the homicides go unsolved. I know you and your office have touted doubling of rewards in some cases, but the clearance rate is only around 42%. What can be done about that to bring justice to more families?
Well, again, that's something that we've been fighting hard on for nearly 8 years. It's been a very frustrating process. We've taken so many different steps. I mean, first of all, we've put over $1 billion into public safety in Baltimore City. We've given Baltimore City Police and the various 4 different mayors that we've dealt with everything that they've asked for to try to get things done. We pushed for tougher sentencing for repeat violent offenders and the people that keep shooting on people on the streets of Baltimore. All of them opposed that legislation, and it failed. It passed the Senate twice, but never got passed through the House. It's a really simple answer. I mean, it's a very complex problem with lots of moving parts. Look, we've invested about $6 billion into Baltimore City, more than any other governor in the history of the state. We've invested in the root causes of crime and record funding in the schools 8 years in a row, more than the legislature provided for. We put more money into workforce development and reentry programs and redevelopment and Project Core, tearing down the blighted properties. But it really takes leadership in the city, and it takes really simple steps. We have to arrest more people. We have to prosecute more people. And the really bad guys that keep doing the shooting have to go to jail. So we have to convict more, and we're not. We're not arresting enough people, we're not prosecuting enough people, and we're not sentencing enough people. None of those things are happening. So arrests are way down, I think nearly 80 or 90%. The prosecutions, we prosecute like 30 people a year in Baltimore City for first-degree murder, for 300 murders. It's outrageous. We've been having these discussions, and there's not, I can't, unless I decide to run for mayor of Baltimore, I'm not sure what else I can do to fix it, but we're going to continue to work with them and provide all the assistance we can.
Governor Hogan, earlier this week we saw voters in San Francisco recall their district attorney who had progressive policies for prosecution, very similar to what we're seeing in Baltimore City.
Very similar.
Do you think that it's time for those policies to change here in Baltimore City, and should voters take notice?
Well, absolutely they should take notice, and it's very similar. Unfortunately, Baltimore doesn't have the ability to do any kind of a removal process like they could do in San Francisco. There is an election in July, and I think voters ought to take notice, and they ought to take a look. I mean, obviously, I've supported through Vignaraja, even though he's of a different party than I am. It's an unprecedented move, but I just said, there's one guy that wants to talk about getting tough on criminals, violent criminals, and that's the only one. The current prosecutor is failing.
Excuse me, let's back to the COVID-19 question.
Oh, good, thank you. I mean, we've got back on track. We'll come back to the other questions, but we want to get a couple of on-topic questions in.
You mentioned about the 50s COVID service centers. Could you summarize what they would look like? How many people go there, how many people would work there?
Right, and so what we're planning to do here is to use the existing infrastructure in the state. We have well over 150 urgent care centers, and what we want to do is that's why we're doing a competition with the invitation for bids, but those that are already providing care on a regular basis, who have, doing testing, doing vaccinations and therapeutics, when a surge comes, we want to be able to work with them and give them the resources, but we don't want to wait till the surge comes. So we want to pre-position these 50, so we have an arrangement with them already. They're in a warm state, which is where we are now, where they're doing the work at a certain level. When the surge comes, we would move in and help them with resources, give them money, and so it would look just like a normal urgent care center, but we may help them by adding a tent, so it's to give them expansion capability. We might bring people. We would provide them more therapeutics. So we're going to be building those relationships. We're anticipating that, like the last couple of years, that it's possible this fall we may see such a surge, or later in the year, and we want to get prepared now.
Governor, continuing on the topic of COVID, the White House held a briefing today in which they discussed having to make some tough decisions regarding their scramble to find funding to help pay for vaccines, including next generation vaccines. Some of those tough decisions involve taking money away from stockpiles for PPE and for testing. How concerned are you that the lack of federal funding might in some way hamper the state's ability to get PPE or to even get the vaccines that you're expecting?
Yeah, I'm not concerned about that at all. I didn't see the president's press conference today, but we have weekly calls with the White House. I just had a separate private call with Dr. Jha, who's the head of their program. Never expressed any of those concerns to me or to any other governors, and on any of the group calls. I think we have plenty of funding. We have plenty of supplies of PPE and vaccines, and so I without seeing what they said today, I'm not sure what it was about.
Earlier today, the commander's deal for Virginia officially died, and the majority of the DC City Council said they don't support bringing the team back to our.
Well, it doesn't come as any surprise to me whatsoever.
And a two-part question, what do you make of those developments? And secondly, do you think Maryland will be offering anything else to the team to stay here in the state?
Look, the Commanders currently own a large property and a stadium in Prince George's County, and as far as I know, currently after that action in Virginia, there's no other potential place for them to go but to stay in Maryland, and we assume that they will, but we haven't had any conversations since Virginia rejected the idea.
Do you think that Maryland would offer additional incentives if perhaps the team was owned by someone other than their current owner?
Look, I think we've invested $480 million in the Blue Line Corridor, all of which will help that stadium. I don't anticipate us doing anything else to support, regardless of who owns the team.
Governor, according to the Baltimore Sun and the University of Baltimore's poll, Kelly Schultz, who you've endorsed, is only 6 points ahead of Delegate Dan Cox, and we're pretty close to the primary election. Does that give you any cause for concern about her footing with voters?
It's just what I've seen is, voters don't seem to be focused on this election. I mean, the same issue is, I think the highest person has 20% on the Democratic side, and that's all. I have no idea, what's going on there either, but I know most voters, 50, 60, 70%, are completely undecided. They don't know that there's a primary on July 19th, and they don't know the candidate. So, I have every confidence that, Kelly Schultz is going to spend, the next 6 weeks or whatever, making herself more well-known to voters, and I'm confident that she's the best person for the job. But, nobody seems to be getting a lot of traction. And maybe they're just happy with the current governor. I don't know, but they're not paying attention to the 16 people running.
Governor, I just have one more question
Yeah.
about Baltimore City schools. Over the past couple of weeks, Project Baltimore has reported on 4 students with disabilities who attend different schools that aren't going to school for medical reasons, yet they're receiving report cards with fake attendance and fake grades. A former principal for Baltimore City Schools says that she was instructed when she was a principal not to leave report cards blank, even if students don't show up, because it can affect funding. To what degree do you believe there is corruption in Baltimore City schools, and is this something that perhaps also should be investigated?
Well, I saw your report and found that outrageous and unacceptable as well. And, I don't know all the details of it yet, but it sounds very similar to North Avenue telling local school administrators, and those administrators telling teachers that they had to, write false grades. This is a different angle on it, but it's the same probably violation of people being told to do things that are fraudulent. So, I will discuss it, get more detail. Probably it's something that the IG should do more investigation into before deciding. I can't make a determination of guilt of criminal violations. Our job, after they did the finding of fact, he did everything he had the power to do, and we've just asked to refer the other cases to the people that can do the criminal investigation. But it's not up for me to make that final determination. But it's outrageous. If the facts that you've been putting out, the people that you've interviewed, if the IG finds that credible, I would imagine that might be passed on to criminal investigation as well.
Governor, in the back and forth that we've seen between you and the mayor when it comes to crime in the city, you've swapped letters and statements. The mayor's invited you to come to Baltimore. Should we expect to see you in the city in the coming future? And do you think that would really address some of the root problems that we're seeing?
Well, it's not really about the mayor and I. This has been going on for 4 mayors now since I've been governor, and we still haven't fixed the problem. I've had multiple meetings with the mayor. We talk on a weekly basis with the police commissioner and Maryland State Police. We're in constant coordination. We've given them on July 1st, they're going to get the $48 million that we gave them. Every single thing that they requested, we've done. The Maryland State Police continues to coordinate with them on warrant apprehension. But I don't think doing a publicity stunt, driving around the city with them. I'm in the city every single week, driving around with him so he can show me how he's really solving crime when they're not, is not going to be probably something I'm not interested in.
Governor, you've signed the Maryland's red flag law, and now gun violence, of course, is getting so much attention nationwide.
Yeah.
How is that law doing here in Maryland? Is there something, is it, just give me some thoughts on it.
I think it's doing really well. Just to take you back to, in Great Mills High School in St. Mary's County, we had a school shooter. There was a school resource officer who killed the person before they could injure many more kids, almost the complete opposite of what happened in Texas. We had one, it was instant reaction, and they took out the perpetrator. I supported and signed into law, red flag law. I also introduced and passed an initiative where we put $218 million into school safety to make our schools safer, and we required school resource officers, armed school resource officers in every single school in Maryland. So I think we're in pretty good shape with respect to that. The red flag law is working. We've had no real serious issues or concerns. Forever, I've said, I support the Second Amendment and the right to, for law-abiding citizens to, to keep and bear arms, but I want to do everything we can to keep guns out of the hands of the mentally ill and people with a criminal background.
Can you tell us about the shooting underway in Smithburg right now?
There's like 3 at the same time. I didn't hear any of them. Go ahead, Aaron.
What can you tell us about the shooting that just happened within the last hour or so in Smithburg?
Yeah, I have been briefed on it, but it's an ongoing situation. We don't have all of the facts, and I'm not sure they're ready to put out all the facts without notifying, next of kin. But my understanding is, but there are potentially 3 people killed. The perpetrator, the state police responded, pursued the suspect. Suspect fired and shot state trooper in the shoulder, who then returned fire and shot him back. And I don't know the status of the shooter, but it's an ongoing, developing situation. I just told you everything that we've been briefed on. I know there's probably more to it, but it's just happened and just before we came out here. So I would say Maryland State Police will be providing more information later as it's available.
Last question.
Oh, good. Dr. Chan, you're going to close this out strong.
Yes.
There's a chance for a few parents who are getting their children vaccinated, but there's still a little bit of fear with even COVID-19 vaccine, especially for those who are young. What advice do you have for some of these parents?
No, it is, first and foremost, I think that parents should talk to their child's healthcare provider so that their questions can be fully answered. The other piece that I've heard from parents is that they don't think that COVID-19 is, affects young kids. And that's true when you only look at comparing young kids to older adults, 65 and older. We know that the risk of hospitalizations and death is much higher in that age group. However, if you look at, at young kids, so this is the under 5 age group, just this year alone, to date in 2022, we've had over 300 kids under 5 who've been hospitalized. And so that's not a small thing. And I know that for me, I don't have young kids anymore, but hospitalizations are something that we want to prevent, and vaccines are a path to being able to do that. If there's a tool that would help families and help parents protect their children, which is our greatest, that's our future, that's our greatest asset, wouldn't you take it? So learn the facts, understand the risks, and that vaccines are truly, as the governor alluded to, still our greatest tool in the fight against COVID-19.
Thank you all very much.